cervical cancer symptoms, causes, treatment, and prevention. The American Cancer Society has estimated about 13,800 women were diagnosed with cervical cancer in 2020. About 4,290 of them died of the cancer. This is a serious disease that can affect any woman. Luckily, there are steps that you can take to prevent the occurrence or complications of the tumor if you already have it. In this video, you will discover not only early signs and common cervical cancer symptoms, but also the causes, medical, and alternative treatments, as well as some simple prevention methods you can do in the comfort of your own home. Before I proceed, kindly support us by subscribing to the channel and like the video. Remember to press the bell icon to get new video updates. Cervical cancer is a cancer arising from the cervix. It is due to the abnormal growth of cells that have the ability to invade or spread to other parts of the body. Cervical cancer typically develops from precancerous changes over 10 to 20 years. About 90% of cervical cancer cases are squamous cell carcinomas. 10% are adenocarcinoma, and a small number are other types. Diagnosis is typically by cervical screening followed by a biopsy. Medical imaging is then done to determine whether or not the cancer has spread. Cervical cancer statistics. Worldwide, cervical cancer is both the fourth most common cause of cancer and the fourth most common cause of death from cancer in women. In 2012, an estimated 528,000 cases of cervical cancer occurred, with about 266,000 deaths. This is about 8% of the total cases and total deaths from cancer. About 70% of cervical cancers and 90% of deaths occur in developing countries. In low-income countries, it is one of the most common causes of cancer death. In developed countries, the widespread use of cervical screening programs has dramatically reduced rates of cervical cancer. In medical research, the most famous immortalized cell line, known as HeLa, was developed from cervical cancer cells of a woman named Henrietta Lacks. Cervical cancer symptoms and signs. Early on, typically no symptoms are seen. Later symptoms may include abnormal vaginal bleeding, pelvic pain, or pain during sexual intercourse. While bleeding after sex might not be serious, it may also indicate the presence of cervical cancer. The early stages of cervical cancer may be completely free of symptoms. Vaginal bleeding, contact bleeding, one of the most common form being bleeding after sexual intercourse. Rarely, a vaginal mass may indicate the presence of malignancy. Also, moderate pain during sexual intercourse and vaginal discharge are symptoms of cervical cancer. In advanced disease, metastasis may be present in the abdomen, lungs, or elsewhere. Advanced cervical symptoms cancer may include loss of appetite, weight gain, fatigue, pelvic pain, back pain, leg pain, swollen legs, heavy vaginal bleeding, bone fractures, and rarely, leakage of urine or feces from the vagina. Bleeding after douching or after a pelvic exam is a common symptom of cervical cancer. Cervical cancer causes and risk factors. Human papilloma infection, HPV, causes more than 90% of cases. Most people who have had HPV infections, however, do not develop cervical cancer. Other risk factors include smoking, a weak immune system, birth control pills, starting sex at a young age, and having many sexual partners. But these are less important. HPV types 16 and 18 are the cause of 75% of cervical cancer cases globally, while 31 and 45 are the causes of another 10%. Women who have had sex with men who have had other sexual partners or women who have had many sexual partners have a greater risk. Genital warts, which are a form of a benign tumor of epithelial cells, are also caused by various strains of HPV. However, these serotypes are usually not related to cervical cancer. Having multiple strains at the same time is common, including those that can cause cervical cancer along with those that cause warts. Infection with HPV is generally believed to be required for cervical cancer to occur. Smoking. Cigarette smoking, both active and passive, increases the risk of cervical cancer. Among HPV-infected women, current and former smokers have roughly 2 to 3 times the incidence of invasive cancer. Passive smoking is also associated with increased risk, but to a lesser extent. Smoking can increase the risk in women in a few different ways. which can be by direct and indirect methods of inducing cervical cancer. Heavy smoking and long-term smoking seem to have more of a risk of getting the cancer than lighter smokers or not smoking at all. Although smoking has been linked to cervical cancer, it aids in the development of HPV, which is the leading cause of this type of cancer. Also, not only does it aid in the development of HPV, but also if the woman is already HPV positive, she's at an even greater likelihood of contracting cervical cancer. Oral contraceptives. Long-term use of oral contraceptives is associated with increased risk of cervical cancer in women who have had HPV. Women who have used oral contraceptives for 5 to 9 years have about 3 times the incidence of invasive cancer, and those who have used them for 10 years or longer have about 4 times the risk. Multiple pregnancies. Having many pregnancies is associated with an increased risk of cervical cancer. Among HPV-infected women, those who have had 7 or more full-time pregnancies have around 4 times the risk of cancer compared with women who have had no pregnancies, and 2 to 3 times the risk of women who have had 1 to 2 full-term pregnancies. Cervical cancer diagnosis. The Pap test can be used as a screening test, but produces a false negative in up to 50% of cases of cervical cancer. Other concerns is the cost of doing Pap tests, which make them unaffordable in many areas of the world. Confirmation of the diagnosis of cervical cancer or precancer requires a biopsy of the cervix. This is often done through colposcopy, a magnified visual inspection of the cervix aided by a dilute acetic acid, in other words vinegar, solution to highlight abnormal cells on the surface of the cervix, with visual contrast provided by staining the normal tissues a mahogany brown with Lugol's iodine. Often before the biopsy, the doctor asks for medical imaging to rule out other causes of women's symptoms. Imaging modalities such as an ultrasound, CT scan, and MRI have been used to look for alternating disease, spread of the tumor, and effect on adjacent structures. Typically, they appear as heterogeneous mass on the cervix. Interventions such as playing music during the procedure and viewing the procedure on a monitor can reduce the anxiety associated with the examination. Cervical cancer treatment. Cervical cancer treatment varies worldwide, largely due to access to surgeons skilled in radical pelvic surgery and the emergence of fertility-sparing therapy in developed nations. Less advanced stages of cervical cancer typically have treatment options that allow fertility to be maintained if the patient desires. Because cervical cancers are radiosensitive, radiation may be used in all stages where surgical options do not exist. Surgical intervention may have better outcomes than radiological approaches. In addition, chemotherapy can be used to treat cervical cancer and has been found to be more effective than radiation alone. Evidence suggests chemoradiotherapy may increase overall survival and reduce the risk of disease reoccurrence compared to radiotherapy alone. Perioperative care approaches, such as fast-track surgery or enhanced recovery programs, may lower surgical stress and improve recovery after gynecological cancer surgery. Microinvasive cancer, stage 1A, may be treated by hysterectomy, removal of the whole uterus, including part of the vagina. For stage 1A2, the lymph nodes are removed as well. Alternatives include local surgical procedures such as a loop electrical excision procedure or cone biopsy. A systematic review concluded that more evidence is needed to inform decisions about different surgical techniques for women with cervical cancer at stage 1A2. If a cone biopsy does not produce clear margins, one more possible treatment option for women who want to preserve their fertility is a trachelectomy. This attempts to surgically remove the cancer while preserving the ovaries and uterus, providing for a more conservative operation than a hysterectomy. It is a viable option for those in stage 1 cervical cancer which has not spread. However, it is not yet considered a standard of care as few doctors are skilled in this procedure. Even the most experienced surgeon cannot promise that a trachelectomy can be performed until after surgical microscopic examination, as the extent of the spread of cancer is unknown. If the surgeon is not able to microscopically confirm clear margins of cervical tissue once the woman is under general anesthesia in the operating room, a hysterectomy may still be needed. This can only be done during the same operation if the woman has given prior consent. Due to the possible risk of cancer spread to the lymph nodes in stage 1B cancers and some stage 1A cancers, the surgeon may also need to remove some lymph nodes from around the uterus for pathologic evaluation. Brachytherapy for cervical cancer. Larger early-stage tumors may be treated with radiation therapy and cisplatin-based chemotherapy, hysterectomy, which then usually requires adjuvant radiation therapy, or cisplatin chemotherapy followed by a hysterectomy. When cisplatin is present, it is thought to be the most active single agent in parotid diseases. Such addition of the platinum-based chemotherapy to chemoradiation seems not only to improve survival but also reduces risk of recurrence in women with early-stage cervical cancer. Advanced stage tumors are treated with radiation therapy and cisplatin-based chemotherapy. On June 15, 2006, the U.S. Food and Drug Administration approved the use of combination of two chemotherapy drugs, Hycamptin and cisplatin, for women with late-stage cervical cancer treatment. Combination treatment has significant risk of neutropenia, anemia, and thrombocytopenia side effects. Surgical removal is sometimes performed. For surgery to be curative, the entire cancer must be removed with no cancer found at the margins of the removed tissue on examination under a microscope. This procedure is known as extenturation. Cervical cancer prevention. Checking cervical cells with the Papa-Nicolau test, or the PAP test, for cervical precancer has dramatically reduced the number of cases and mortality from cervical cancer. Liquid-based cytology may reduce the number of inadequate samples. PAP test screening every 3 to 5 years with the appropriate follow-up can reduce cervical cancer incidence up to 80%. Abnormal results may suggest the presence of precancerous changes, allowing examination and possible prevention treatment, known as colposcopy. According to the 2010 European guidelines, the age at which to start screening ranges between 20 and 30 years of age, but preferentially not before the age of 25 or 30 years, and depends on burden of the disease in the population and the available resources. In the United States, screening is recommended to begin at age 21, regardless of the age at which a woman begins having sex or other risk factors. PAP tests should be done every 3 years between the age of 21 and 65. In women over the age of 65, screening may be discontinued if no abnormal screening results were seen within the previous 10 years and no history of CIN2 or higher exists. HPV vaccination status does not change screening rates. A number of recommended options exist for screening those 30 to 65. This includes cervical cytology every 3 years, HPV testing every 5 years, or HPV testing with cytology every 5 years. Screening is not beneficial before the age of 25, as the rate of the disease is low. Screening is not beneficial in women older than 60 years if they have a history of negative results. The American Society of Clinical Oncology guideline has recommended for different levels of resource availability. Barrier protection. Barrier protection, or spermicidal gel, used during sexual intercourse decreases but does not eliminate the risk of transmitting the infection, though condoms may protect against genital warts. They also provide protection against other sexually transmitted infections, such as HIV and chlamydia, which are associated with greater risk of developing cervical cancer. Vaccination. 3 HPV vaccines, Gardasil, Gardasil 9, and Cervarix, reduce the risk of cancerous or precancerous changes in the cervix and perineum by about 93% and 62% respectively. The vaccines are between 92% and 100% effective against HPV 16 and 18 up to at least 8 years. HPV vaccines are typically given to age 9 to 26 as the vaccine is most effective if given before the infection occurs. Nutrition. Vitamin A is associated with a lower risk, as are vitamin B12, vitamin C, vitamin E, and beta-carotene. Thank you for watching to the end. Please like the video and subscribe to the channel and share this video with more viewers. If you are an ovarian cancer survivor or professional, kindly share your experience with our viewers.